My name is Dr. Dayyaba Shaibu. So I'll just introduce myself. Thank you, Architect Alau, right? Sorry, for that beautiful picture of the mentally ill person. I'll just give you a brief about my journey to mental health. I was this individual that if I was crossing the road and I saw a mechanic, you know, the way they're always all greasy, all dirty looking, I don't even wait to find out if the person is a mechanic or is mentally ill. I'd rather run into the road before thinking. So almost 20 years, first psychiatry posting, the first class, the psychiatrist comes into class and he says, I know a few of you that will end up in psychiatry. And he says, I know Lawal is one of them, that's my maiden name. And I'm like, of course not me, definitely not. I was literally terrified of the mentally ill, and I'm sure that's how a lot of us were or still are. Mental health today, not the way it was many years ago, I'm sure we all agree. And the architect already said a lot. You know, he says mental illness is not just, you know, that picture that we see. And I always tell people I come across, we don't have the word MAD in our vocabulary as mental health practitioners. That word just doesn't exist, you know. A lot of us have anxiety issues, a lot of us have experienced some form of trauma, a lot of us have mental illnesses. And as long as we accept that mental illness is an illness, just like diabetes and hypertension, then it's easier to accept. Because the reason why mental illness is frowned at is because of the stigma. People say, oh, they have madness running in their family. Oh, they have... How many of us ask if there's diabetes or hypertension running in their family? They're all diseases that are hereditary, you know, that have a genetic component. All right? So I find myself today in mental health because somehow I think I had time to study myself, and I found out that that was the best place I could function. I used to be in family medicine in the teaching hospital Zaria. And I had a lot of offers to go to a lot of the different departments, but for some reason, I found out that I was more functional in the general outpatient department. A lot of us have that one doctor that want to have the number. Please, I need to come to the hospital. Are you on duty? Just to make, you know, the movement smooth and short and easy. Why? Because our system doesn't work. I was serving, and then I see cases and I tell them, sorry, we can't handle it in this general hospital. You have to go to the teaching hospital in Zaria. And these patients actually kneel down and they beg, doctor, please, for the love of God, just treat me here. But I can't. You know, it's beyond the capacity of this hospital. Why? Because they feel if I go to the teaching hospital, I don't know anyone, I have to know someone before I can get attended to. So I found more satisfaction in that general outpatient department. Why? Because just a little counseling, not necessarily the sickness or the illness that brings the patient, but just that little 2 minutes of giving them orientation. You know what you need to do? I'll see you here. 2 doors down the corridor is the lab. You finish that, you bring the result. I'll see you and I'll give you your next appointment. And it has, you know, taken care of up to 30 to 40% of the patient's problem and the anxiety. So I found out that that was where my job satisfaction came from. A few years ago, I went for a meet like this. I'm a serial entrepreneur. I sew. I love to design spaces. Where's the interior designer? I think I'll come learn. You know, so I just derive pleasure from this kind of thing. So there was a meet like this where entrepreneurs came together to share ideas. And I was having a conversation with someone, and she says, oh, you sew kids' dresses? And I said, yes. But I'm also a medical doctor, mental health. And she's like, oh, interestingly, I will give you the number of my brother. You know, I think you should talk. And at that time, talking was about, I wanted to do, you know, go for more courses and all that in mental health. So that was the thinking. And then we got speaking with this brother, and he's, oh, have you heard of sign-up services? And I'm like, what's that? Okay, this is the website, just look it up. And it was just a dream, like mental health the way it should be. It's not the asylums that we know. it's mental health, like it's an experience for the mentally ill. So that's how I came to start working with Synapse Services. Synapse Services is a center for psychological medicine. It's the largest private mental health practice in West Africa. Centers in the Northwest, in the Southwest, you know, and centers in all 6 geopolitical zones. So it's a private practice that takes care of psychiatry, drug addiction, and mental illnesses. Not your average Dayyabah left, for lack of a better word. Yeah. Okay, so that's Synapse Services. I'm a clinical lead at Synapse Services. Reconnect Health Development Initiative is a mental health charity. So now Reconnect makes it easy for people to understand what mental health is. It's easier if we go for advocacy, if we go talk. You're not paying to see us. We make people understand what mental health is, and then it helps you signpost. We do a lot of school programs. We do a lot of family support programs. We run monthly programs for people struggling with different issues. So I'm the National Coordinator for Reconnect Health Development Initiative in Nigeria. Olive Prime Premium Psychological Services is the youngest of all. I'm a co-owner of Olive Prime Premium Psychological Services, just like we said. Beautiful space, a kind of place where you want to come in, you want to proudly say, I'm seeing a therapist here. A lot of people don't want to say it, but Olive Prime is a nice place to be. So, knowing yourself, just like I said before, how many of us really know ourselves? You know, just taking time out. Like step outside, I always tell people, just step outside your physical body, like mentally, and kind of look at yourself and say, who is this person? Like, what are you doing? Who am I? What are these things that I like? What are these things that make me happy? The next slide. What are these things, you know, that how do I function? What drives me? What is my why? You know, and I want us to just go through this and ask ourselves these questions. Because a lot of times I see patients, there's a particular part of our assessment template that says, what's your personality? How will you describe yourself? I will always get stuck there. A lot of people can't even say what kind of person. For personality, a lot of times, the next person is better able to describe us, but we should know ourselves to a certain extent. Like, okay, I'm a quiet person, but you know, I function in this kind of spaces. I don't like being around this kind of people. We always know, but sometimes we're just too like mobile to kind of accept that this is the kind of person. Everyone has a limitation. Everyone has a breaking point. Everyone has that thing that just spoils the rest of their day, you know. So what's your personality? What are your strengths and weaknesses? Not everyone is a fantastic professional. Not everyone is a fantastic book reader. And it's perfectly fine. We're all different. I always get impressed when I hear people say, I'm a researcher. Oh my goodness, if you want to kill me, just give me research to do. I'm not going to function. You know, so understand your weaknesses. Accept them. That's the person you are. What are your likes and dislikes? Because again, which we'll see later in my presentation, these things make up what I call your mental space. We need to really jealously protect it, right? What's my happy space? What is that thing that just gets you going? Where is that place? Not necessarily a physical space, because everyone wants to travel. But even when you're traveling, what kind of travel? Everyone thinks of traveling and shopping. Is that really what makes you happy, or is that what is expected for, you know, of you when you travel? What drives me? For some people, I'm looking for this next job because of the pay. Is that really what it is? You know, like recently someone was telling me, oh, NMPC is recruiting. Dr. D, are you not going to apply? And I said, I don't think I want to treat vomiting and diarrhea, because that's not what, you know, keeps me. My husband is a doctor, by the way. He's an emergency physician, and then emergency room physician, and then he comes home and he's like, I saw this case today, you need to look at it. And I'm like, I can't. It's like, when did you become this way? You can't even see lacerations that you used to suture in the past. I'm like, I think I've moved on. I'm unable to function in that space anymore. What's my ideal work environment? What kind of workspace, you know, makes me happy? 10 years ago, I used to have a store. You know, the way we all have like our offices, we have this nice desk and chair. I had an office that just had pillows on the floor, and because I knew that when I closed from work, I would have seen enough of desks and chairs. I didn't want to come to that little space and then still be sitting formal. That's what works for me, and that's what made me happy. So it's important we know these things. So what is mental health really? Because this word mental, and again, it's because of the way we've been using these words. Are you mental? You know, so it became like an insult, you know. So really, the general health is in two phases. We have the physical health and we have the mental health. The physical health is where we can see the diabetes, the cuts, the cancers, you know. The mental health has to do with the mind. And a lot of people, you know, when you talk of the mind, they go like, oh, I was scared. That's not where the mind is. The mind is up here, actually. The mind is here. That's the brain. That's mental health. It's a state of well-being in which the individual realizes his or her own abilities, knowing yourself again, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Balance, finding balance. You know, sometimes you find out that, for someone like me, I know I'm getting over the edge when I start snapping at my kids. Mommy, what is it? And then I'm like, okay, that is plenty stress. You're not functioning. What has that child got to do with whatever baggage you're bringing back home, you know? So it's beginning, you know this word that we always use, I'm stressed. It's significant, yeah? So that's what mental health is. So how mentally healthy are you? People who are mentally healthy do not become overwhelmed. It's difficult in our part of the world. I know we can't be 100%, but you know, to a large extent, the more the consciousness, you know, the more balanced we are. So they feel good about themselves. Go on, there's a list. They do not become overwhelmed by emotions such as fear, anger, love, jealousy, guilt, or anxiety. So there's there's this inner satisfaction, you're fulfilled. They have lasting and satisfying personal relationships. They feel comfortable with other people. They can laugh at themselves and with others. So you embrace who you are. Your weaknesses, you laugh at it. That is who I am. You know, accept it or not. They have respect for themselves and for others, even if there are differences. So you respect other people's shortcomings, yeah? They are able to accept life's disappointments. They can meet life's demands and handle their problems when they arise. They make their own decisions. They shape their environment whenever possible and adjust to it when necessary. So what is mental illness? Of course, when you're not mentally healthy, you're mentally ill, right? So, interesting statistic, 1 in 4 people will at least have one mental illness at some point in their lives. So if we're 20 in this room, at least 5 of us, you know. Anxiety, post-traumatic stress disorder. Sometime last month, I was on my way home, you know, from work. I got double-crossed by a vehicle, surrounded by 6 armed men. I was robbed. So till today, I still have the flashbacks. Till today, no one looks at me. And I'm like, why is he looking at me? That's probably one of them. You know, I had to change the color of my car because I'm like, they probably know me and all that. So that's post-traumatic stress disorder. It is a mental illness, you know. It wears out with therapy. You talk to someone, it goes away. How many of us have faced robbery attacks in the house? And you keep having flashbacks, you know. How many people have experienced a near rape experience or have been raped? Even someone just saying hello, you kind of cringe, you know. But we don't accept it as mental illnesses. They're mental illnesses. Depression, because it's the most talked about mental illness, people tend to accept it more than the other ones. So even if someone comes with psychosis, they tell you, oh, he's just a bit depressed. We accept it just to make you accept, and then after a while, we educate you. So that's mental illness. These conditions are complex and multi-causal. We always say that there are different things that cause mental illnesses, just like diabetes and hypertension. I like to give these examples because we tend to relate more with those ones. If your parent has diabetes, it does not mean 100% that you come down with diabetes. It just means you have a genetic predisposition to it. So what is the other factor that will, you know, tilt you into getting diabetes? Lifestyle. You know, so if you know that you have a genetic predisposition, then you protect, you watch your lifestyle just to reduce your chances, yeah? So many assume mental illness simply runs in families. This is true, but genetics, just like I said, is just a part of it. They actually occur due to a combination of factors, including the person's environment and lifestyle. So we usually say mental illnesses are caused by 3 factors: bio, psycho, social. So biological, genetics; psychological, life events; social, our environment. So the environmental influences on mental health. So the world we live in, generally, yeah? Lifestyle and social support. Who are the people we surround ourselves with? What kind of space? You know, what vibes do we give out? What vibes do we take in? So the physical environmental factors, this is it. Your biology, genetics, right? Our habits, that's the lifestyle, what we eat, what we do, exercise, sleep pattern, substances we take, pollutants, landscape, you know, work conditions. Some people know that from that Sunday 9 p.m., you're already in a bad mood because you're going to work. You just have to do it because you have to survive, unfortunately, but the work environment is a major stressor, right? So work environment, you know, adds to our mental burden. So the physical continued. We have the diet and nutrition. Diet and nutrition. I would like to say that the brain never sleeps. It works 24/7. So just like you have that Bentley, of course you don't just buy any engine oil to put in it. You have to look for that premium, you know, engine oil. So the same thing, the brain that works even when you are asleep, you need to be mindful what you feed it. You know, refined sugars, no, for mental health. Sleep deprivation. Up to 90% of people who have mental illnesses have sleep issues. It's recommended that even adults sleep for at least 7 hours a night. I don't know how many of us are able to get that, but that's the recommendation. And just having adequate sleeps reduces your chances of getting mental illnesses by up to 30%, just sleep. Smoking, we cannot overemphasize that. Substance abuse, if we start talking about substance abuse, we won't finish today. Pollution, exposure to toxins during childhood. Of course, that's when the brain is developing, and any assault to the brain at that point. Hazardous conditions at work, so, you know, self-explanatory. So social environmental factors, social stigma. For instance, we don't have that much in this part of the world. People accepting, for instance, someone grows up in a community where she's known to have been raped. How is she supposed to function? How is she supposed to even get a job? Or someone has HIV/AIDS, you know, she goes for a job and she's refused an opportunity just because of that her medical condition. So of course, it has a way of affecting people. History of abuse, sexual, physical abuse, emotional abuse, family discord during childhood. I think they're all self-explanatory. Early loss of a parent, poverty, spirituality or religious affiliation, interestingly, because in this part of the world, we're very religious people. So even things that we're not supposed to hinge on religion, we tend to hinge it on religion. So I think that particular aspect kind of helps us mentally, you know, even though sometimes it tends to get excessive. Lack of meaningful work or hobbies. How many of us have hobbies? How many of us just work, go home, sleep, and repeat cycle? Toxic relationships. It's important for us to identify this and do away with them because they have a very huge, you know, effect on our mental space. You know, relationships that are not working. If they're not working, if they're not adding value to you, you know, there are slides later that, you know, emphasize that toxic relationships. How many of us have heard of the blue zones of the world? Blue zones of the world. They have like 5 islands in the world where people live up to 100 years and above. And we'll see the things that they have in common. Lack of self-care and or relaxation. This lack of self-care or relaxation, I always say this thing. You have to take care of yourself before you can take care of others. It's like a cup. You can't pour out of an empty cup. So you need to make sure you fill that your cup before you can pour out of it. So take care of yourself before you can think of the next person. Okay, the blue zones of the world. So they are the world's 5 healthiest communities. They have community support and connections as one of their central pillars. No technology, no microwaves, no nothing, no technology. The people live up to 100 years and more. Those are the islands in Italy, Japan, California, Costa Rica, and Greece. Next slide. So what's the secret? Their lifestyle. Yeah? Healthy diet, daily exercise, low stress life, family, purpose, religion, and meaning. That's the connections. So everyone looks out for the next person. Everyone reaches out. Everyone. Interestingly, we have these gadgets that are supposed to help us reach out, but I think they're just, doing the opposite. The next slide. So we talk about colors and the mind. Let's go a bit design. Yeah. Colors have a great impact on the mind. They largely influence the way we feel, which I know will agree. Yeah, Mr. Ibrahim. We're on point, yeah? Colors of healing influence mood. They calm the nervous system, make the environment less provoking and peace-inducing. Use of these colors in a room or clothing can significantly change a person's mood and evoke mind-body benefits. This is like a typical hospital corridor. How many of us have seen a hospital painted red? So a lot of times, yeah, consciously or subconsciously, there are colors that are used in spaces that, have to do with healing. Like when we're designing Olive Prime, we actually had to go specifically to study these colors and know what color we're going to paint each room, the blinds and all that. It saved us some money from hiring Mr. Ibrahim. Yeah, so can colors heal you? Yeah, so we'll find out the benefits of colors. There are 7 colors of healing, they are documented. So red is passionate, is warm, it induces vitality and stimulates energy. So you don't use that color in a room of someone that has hypertension because it stimulates. Yeah. So it's used minimally in hospitals. At home though, you can use this for people who are suffering from, lethargy and all that. So it boosts appetite because it's a color of passion, increases energy. But even at home, I don't think you want to paint a whole room red. Maybe just like a wall that, gives you that effect. So orange is a color here used according to color healing therapy. It's one of the best colors, especially for children, rooms of children. Radiates warmth associated with joy and happiness. Yellow, bright and cheerful. It detoxifies the body and mind. Dermatologists tend to like this color, even if it's just the flowers. I think it's used for people that have skin issues a lot. But it inspires creativity. So it's used for people who feel sluggish or lethargic. So it's encouraged in rooms of people that have depression, Green, we cannot overemphasize green. Color of nature, balanced healing properties. It is restful, symbolizes growth and renewal. Encourages comfort and equilibrium. It's beneficial for the heart, lungs, and circulatory system. Yeah, lungs. He talked about his asthma experiences. Blue, color of spirituality. Nature, sky, sea, so calmness and serenity, helps lower blood pressure, reduces rapid heart rate. Blue is relaxing for the mind and body. So for rooms where you meditate, the softer hues of blue actually help. How many of us have heard of mindfulness? I'll just give you that today. We can just download these 2 apps. There's one that says Calm, one says Headspace. They're very good apps. I'll just come back to this. Let me just say this so that I don't forget. Every day, our body is in the Fight-Flight-Fright syndrome. We're always either hurrying to do something, or we're always scared of something, or someone is getting us agitated and we're all, So we have 2 major lines of the nervous system, the sympathetic and the parasympathetic. The sympathetic stimulates the fight-flight-fright. So every day we're always on the high, and the only thing that can calm the sympathetic is the parasympathetic. And what does the parasympathetic need to do? Just deep breathing. And it just calms down everything. Blood pressure calms down, heart rate calms down, pulse rate calms down. So this Headspace and Calm are just meditation apps that help you just take a few minutes out of your day to just breathe. Deep breathing. It's been found to promote sleep, to reduce anxiety, to take care of depression. Yeah? So we'll continue. Next, pink. It's a very feminine color. It's a soothing color that shows caring and affection. The deeper hues, like the fuchsia pink, is very close to red, so you want to avoid, all that. It stimulates happiness. Too much of bright pink, just like I said. It can safely be used in hospitals and prisons to reduce erratic behavior, because if the darker ones are high, they stimulate energy, but the softer ones calm people down. I don't know how many prisons we have that will be painted pink anyway. Purple, beautiful color. All the shades of purple are beautiful, especially the lavenders, the lilacs, They're connected with spirituality. They're linked with perception and higher consciousness. We like perception a lot in my mental health, because how you see things is how you react to them. Yeah, and it improves insight. So health-wise, these colors are linked with the cerebral and nervous system. So shades of purple are our friends, in mental health. So caring for your mental health. First of all, accept who you are. Just like I said before, wherever you are is who you are. And then once you have that acceptance, then you can now decide to outline your goals, what I want to improve about myself, what I know I can't change about myself. Keep active, exercise. Has been found, when we exercise, really, it's not just about losing weight or about building muscles. When we exercise, our body releases what we call endorphins. Endorphins are happy hormones. So you actually just take a 30 minutes walk, you actually find yourself happier. So exercise has been found to take care of mild to moderate depression, just as good as antidepressant medications do. Of course, without the side effects. So some people, all they need to do is to get back into an exercise routine, and depression just goes away because of that simple, release of endorphins. So eat well, we cannot overemphasize. Eating healthy, avoid refined sugars, Drink sensibly. The Association of Lifestyle Medicine right now preaches no alcohol. But for safety and sanity, we leave it as drink sensibly. But the teaching right now is zero alcohol. But even we, the clinicians, find it difficult to preach zero alcohol. So we leave it as drink sensibly. Build a healthy network. So good job. We meet people today. You find people who you share common goals with. Just a 5-10 minutes conversation with someone who shares your energy just makes you feel good. So you keep in touch. A lot of work we need to do in that aspect. Talk about your feelings. One of the biggest problems or fears about talking about our feelings is the fear of judgment. You're really feeling low, and you're trying to tell someone, they're telling you, you shouldn't be complaining now. You have all this, you have all that. Why are you complaining? That's a sign of ingratitude, blah, blah, blah. And the person doesn't understand, So talking about your feelings, if you have that one person who will not judge, fine. That's a very good support system. For fear of judgment, there are plenty of resources out there. Like the next one says, ask for help. Enroll in an employee wellness program. Like our organization has this employee wellness program where we encourage organizations to enroll their employees. If I'm at home and I have an abusive husband, I'm not going to come to work and go tell human resources that my husband beat me this morning before I came to work, because it just becomes office gossip. And then my boss still expects me to function. Or how do I go apply for leave just because my husband beat me? So what employee wellness program does is there are phone lines with psychologists at the end of the line. So I'm able to call a psychologist, talk about my problems, and I get therapy. All my employer sees is my productivity is peaking. Whatever I'm doing is not the employer's, business. And families can actually still enroll children on that. If your teenager is having unholy alliance on Instagram, the chances of her telling her mom or dad is very slim. Sometimes they're even very unsure of even their sexual orientation, So sometimes they're confused, and at that point they're worried that if I tell mom will call all the men of God on my head just to come and, pray for me and, reset my brain. So that's what a wellness program does. We have the family wellness program, the employee wellness program. Basically, without being judged, a therapist, a professional talks to you, walks with you through that, crisis. Take a break. When you've reached your limits, please take a break, slow down, because there's no work that will stop when you're gone. And I always say it, if the president of a country could die and before his body landed his hometown, the next president was sworn in, then no one is indispensable. When you reach your breaking point, please take a break. Do something you're good at, something you enjoy, something just gives you joy, regardless of what comes out of it. So if you have a job that keeps body and soul together in terms of remuneration, just do something else that makes you happy so it compensates. You should care for others. I always say the true joy is in what you do for others. We are a community of taking. We take more than we want to give. Very few people actually have that spirit of giving, actually derive joy from helping the next person. But I think we should, imbibe that. There's a good feeling that comes from it. Identify your happy place. If that's all we'll take home today, please, let's all take time. Identify that space that just gives you that high. Of course, the positive high, not the, artificial one. Next slide. So our take home for today, overall health and well-being require a good balance of mental, physical, social, emotional, and spiritual health. Yeah? Although mental illness itself is heritable, a wide variety of factors like the genetics, economic, social, and physical influences also contribute to the development of the disorder, just like I explained before. So again, where is your happy place in the world? Not necessarily physical, but just that space. It might be a little part of your house that whenever you enter that room, it just gives you this energy, So identify that happy place. That place, when you identify it, is your mental space. You identify it, you make sure it's a positive one, you nurture it, and then you protect it. When you see it, you jealously protect it. You can see this picture, it says, no issues today. I'm in that my awesome bubble, like no one is allowed in. I jealously protect that space. Anyone that wants to encroach, you just, So these are valuable resources that will help us. Thank you very much.